how do we make the biggest impact? And the good thing is that there are ways. So when we focus all of our prevention efforts on individuals, it assumes that people have full control over the conditions of their lives. But the reality is that most people don't, right? We just talked about all the reasons why. We make choices inside of our environments. So if someone is living with housing instability, financial stress, social isolation, or constant exposure to harmful norms, information alone can't outweigh those other things. And that's not a failure of the person, right? It's not a failure of the individual. It's a mismatch between what we're asking of individuals and what their environments are set up to support. So that's why sometimes individual level strategies like giving a one-time presentation on their own have a limited impact on getting people to actually change. It's not because they aren't meaningful, it's because they're trying to swim upstream against some really strong currents. When we look at trying to impact environments, we are shifting responsibility to where it belongs, onto the systems, onto the norms, and onto the environments that are really shaping people's lives. And this might be an image that is familiar to many of you. If it is not familiar to you, welcome to the social ecological model. It is less important that we know the language than it is we understand the concept. What it is it's really a tool that allows us to see how the different areas that we live through and move through in our daily lives impact one another. So I'm going to give you an example of what the focus is at some of these levels. So we're talking about individual prevention work. We're really focusing on personal behavior. So we are, again, teaching people what is appropriate, what is inappropriate, what is harmful behavior. A lot of this can sometimes fall in that information area. When we think about the relationships, we're trying to impact people's peers, people's families, people's social circles. So that could look like, if we think about like a school system, maybe the individual is we're doing classroom presentations. The relationship level might look like now we're also bringing in the parents and we're going to talk to them about sexual violence and intimate partner violence. If we move to the community level, we are focusing on the actual settings. So we're looking at the actual school, right? What kind of policies does the school implement? What kind of culture does the school have? We're looking at more of the way that the school environment is supportive of violence or supportive of healthy behaviors. And if we move to the societal level, that's where we're really talking about things that impact all of us without us even having to interact with them. So things like the larger norms of our culture and society, the policies that we all, are subject to, and also cultural beliefs. So the dream is that we're doing work across all of these levels, right? Because they all intersect with one another, right? I am an individual person, but I'm also part of a family, and I'm also part of social circles. I also live in a rural community, so I'm part of that setting. And I also live in the state of California, so I'm part of a larger society. So for me to be impacted by something, I need things happening at every single one of these levels. My last point on this is that it's when we're thinking about working with individuals and even at the relationship level, it's really up to us to impact every single person in order to create widespread change. That's a lot of people. Like in our Fisher story, it's a lot of people to save. It's a lot of people to talk to. It's a lot of people to give information to. When we think about work that we can do at the community and societal levels, communities and the people within the communities are the ones actually impacting each other. We plant the seed and it continues to grow without us. So you can think about another public health issue from the past, like seatbelt laws. We didn't learn about the importance of seatbelts by someone coming to our classrooms and giving us a presentation, right? We probably learned about them through media campaigns, through our parents telling us we had to wear them, through laws that if we don't wear them, we get punished, right? No one had to individually come and talk to us about them, most likely for us to get the message that they were important. So that's an example, obviously, very different issue, but shows how we were able to have like a whole norms change around seatbelts. And it did not require us to go to every single person and tell them.